Hello and welcome to another episode of Conversations with Dr. Westman. Today we're going to be talking about fertility on a keto diet. Hey Eric.
Good. How are you doing, Glenn?
Very, very good. Thank you. So Eric, I know that there's clear evidence that a keto or low carb diet helps with fertility in women. Can you explain why this is the case?
Sure. Our research paper, was published now, over 10 years ago. So we've observed, as many other clinical low-carb keto doctors have observed, that the change that happens when you eat carbohydrates, in some people, you have to have that susceptibility, can actually lead to insulin resistance and also conditions like polycystic ovarian syndrome, which is one of the most common causes of infertility in women. And a lot of people don't understand that it's not just the extra weight, it's the carbohydrate consumption. Because remember, what you eat matters in terms of the hormonal response to what you eat. It's not just calories, it's also the hormonal response. And when you eat lots of carbohydrates, the blood sugar goes up, and then the insulin goes up to lower the blood sugar, and this is the beginning of what's called insulin resistance. Now, one of the parts of the body that doesn't get a lot of attention is the female ovary, and the female ovary is in charge of letting eggs out that then become fertilized, and then you get pregnant. So when you eat carbohydrates and have insulin and insulin resistance, it blocks the ovarian or ovary from letting the egg out. And you can get these cysts, which really are just kind of eggs that never got out, and they die, so to speak. They're not really alive, but anyway. So this is the name for polycystic ovary or polycystic ovarian syndrome. So these eggs don't get released from the ovary, which means you don't have the ability to get pregnant. So put it all together, fertility is related to what you eat, and carbohydrates cause polycystic ovary syndrome.
Now, what is the difference between that and endometriosis? Just so that someone could get a clear understanding, and also, will a keto diet help endometriosis?
Yeah, endometriosis is a different disease entirely. I don't have a whole lot of experience with endometriosis and keto or low carb. That's an interesting question. I'm just not sure. I have much more experience with PCOS and infertility. In general, endometriosis causes pain. It's the endometrial tissue where it's not supposed to be. And I don't hear that as a strong clinical signal, but that's a different type of disease that I'm not sure keto would help for.
So for people that are suffering with PCOS, I've heard that it's typical to have an irregular menstrual cycle. Is that one of the hallmark signs?
Right. So getting back to that ovary, where the eggs come from, if that's not normally working, then the hormonal control of the menstrual cycle, where you're making tissue in the uterus and then sloughing it, is all messed up. So your periods are not normal. They may be heavy or non-existent, and irregular periods are often why someone goes to the OBGYN, the obstetrician gynecologist, for help, and then they get diagnosed as polycystic ovarian syndrome, either by the history or by ultrasound of the ovary that shows these cysts. So yeah, it's common to have irregular menstrual cycles, or heavy. They're not every month, they're every few months, or they're non-existent.
And Eric, obviously in your clinic, you must see quite a few cases with people with PCOS. What sort of success rate do you see in your clinic?
Well, the success rate is very high. Of course, you have to, the caveat is you have to follow the program, and often if an individual is very heavily carb addicted, sugar addiction is real, it can be harder for someone to follow it. But if you have a motivation to have a baby, and we have high confidence that the simple diet change will help you have a baby. I've had great success with people, even after they've gone through the medical treatment for infertility. So, I work in an area where there are super subspecialists who will give you special medications and try the in vitro fertilization, meaning they're actually helping you get pregnant. Even when that fails, simply changing the food and then leading to the weight loss as well, fixing the underlying insulin resistance can work. So I've had people become pregnant within just a few weeks of changing the diet. So it's one of these things where, you can go to the other doctors and get put on pills and medicine and all this, or just try this for 2 weeks. And if you have the metabolic change, the periods are coming back, you know that you're fixing the underlying problem without all of the other pills and products and surgeries.
Well, this is certainly a topic that a lot of people will find very interesting, and certainly one that, if we can help just one person, I think that we would have achieved our job today. So thank you for that. I'm going to move on to a couple of questions. First question I have, Lindy. Lindy asks, I had PCOS and started a keto program a while ago. I recently became pregnant. Will this way of eating be healthy while pregnant as well as for the baby?
Well, I think so. So I don't have research to back it up, which I always like to have a study to be able to point to. So this is where the clinical use of a keto diet, meaning people are just doing it, is way ahead of the published research. And so there are some keto PCOS and keto diabetes groups where people are getting pregnant and continuing the keto diet. There's a great essay at dietdoctor.com on, do I continue keto during pregnancy, or LCHF, Diet Doctor likes to call it. I was most persuaded. I was fortunate enough to teach the keto diet in 8 different countries in 2019. And one of the countries I visited, the country of Indonesia, has a group of hundreds of thousands of people using a keto diet and using fasting. It's called Ketofastosis Indonesia. And at that conference, I learned from the pediatricians from their area that they had lots of keto babies. I didn't know this term keto baby. So they came up with this term keto baby, meaning the mother was doing keto while the baby was in uterus during pregnancy. So, and they were explaining to me that they thought even the developmental milestones were better for the babies who weren't eating carbohydrates. Now, this is just word, doctor to doctor, word of, giving information by mouth, not through research. And so, but when I look back at what the body needs and what the baby needs, you're giving all of the nutrients that are necessary for human growth and thriving when you're not eating carbohydrates. So I don't, and the obstetricians were the first ones really as a group to say, if you have diabetes during pregnancy, you have to limit carbohydrates. So they've known for a long time about gestational diabetes. It's just they never went lower than the ketone level. Because you have to understand in the US, it's a very litigious culture. And if something happens while someone's pregnant, if you go outside the mainstream, you are at risk for getting sued by the parent. So that is one of these non-medical, non-scientific factors that are at play with how things play out or are practiced in the US. They don't have that sort of concern in Indonesia. Apparently they aren't suing each other left and right. And I mean, that aside, the word I got from other doctors who are following thousands of people doing this, and I would say probably dozens of keto moms and keto babies, is that they reassured me about it. So I think it's okay. I don't know for sure. And a related sort of area. I am the past president of the Obesity Medicine Association, and we have lectures from people about just when mothers lose weight. There was an interesting lecture. I remember the obstetrician basically said, we're going to be doing ultrasounds of the baby, and we're going to do it frequently. And this wasn't in regard to keto, it was just in regard to weight loss. And basically the message was, we're going to monitor the baby. The doctor didn't really care what we were doing in terms of the mother's weight. So the mother might actually be losing fat weight off the body to feed the baby that's growing. And so it's possible that you may actually lose weight if you have extra weight to begin with during pregnancy. So that's one of those, things the doctor might say, you're not gaining weight, what's wrong? Well, actually you might be shifting over your fat weight to feed the baby and actually losing total weight off your body. So again, it kind of throws a wrench into what we commonly see. And to be honest, I don't know how healthy it is. My intuition is that it's going to be healthy, which means, of course, monitor with a doctor the typical milestones. Don't just take my word for it or anyone else's word for it. Be monitored if you do choose to do it.
Fantastic. Well, just on that topic itself, you've obviously seen quite a few people that have had issues with PCOS and they've recovered following a keto diet or low-carb diet. Just from anecdotal type of evidence, have you followed it through from falling pregnant to having the baby? In your experience, did they stay on the program all the way through and you've seen no kind of problems associated with that in terms of anecdotal kind of evidence?
I have, yeah. So anecdotally, I would say probably 5 keto moms, keto babies, which is not enough to write home about. But in fact, when 5 or 10 anecdotes occur, what my method is to write that up into a paper, publish it, to get the word out, see if other people are seeing the same things. So that's one of those kind of surveys that could be done among Facebook groups. And so that's actually a thing where we've surveyed Facebook groups who do keto and low carb and type 1 diabetes. And that was published in a peer-reviewed medical journal. It's so far ahead of what the academic people are doing. It was novel enough to be published in a journal and solid enough, the science behind it.
Right. Okay, I've got another one. Adriana asks, she has PCOS and have excessive hair on her face. Will this go away on a keto diet?
Yes. So PCOS is a syndrome. There's no blood test you can check that says, you have it. And even some people don't have the ring of pearls or the sign of cysts in the ovarian ultrasound. So often you're left with a syndrome, meaning you have certain things and then you fall into that category of PCOS. So one of the most common things women have with PCOS is excessive hair growth. So you might find that you have to pluck or shave or wax the hair off the face, off other parts of the body, and that gets better actually. This is we've done the research paper that we did some years ago now. We asked people about the hair growth and the menstrual cycles, and that actually improves. And so if that's an issue, not the fertility or the menstrual cycles, the excessive hair growth can actually improve. And the other thing about polycystic ovary syndrome is you might not have all of these things at the same time. So the excessive hair might be a clue that you have it, and certainly ask your doctor about that.
I've got one more question, last one, and that's from Laurie. And you may have already answered this question briefly, but she asks, or she says, I have PCOS, have desperately wanted to fall pregnant, been to a fertility clinic, taken all the medication, but the medications aren't working. If I start a keto program, how long could it take to reverse her PCOS?
Yeah, so I feel the pain of going to the usual medical system of giving drugs and pills and and other interventions, and even that might not work. And then the doctor thinks, oh, well, why don't you go lose weight with Dr. Westman? and why it's the last thing that they think about is, well, that's not what they do, right? So I have had people go through that whole process and not become pregnant. They've done that, and they come to my office, get taught a keto, low-carb diet, and they can get pregnant within a few weeks. So you have to understand that you can actually ovulate, put an egg, have an egg come out of the ovary before you have a period. And you have to understand how the body works and all that. But so we will explain that you may become pregnant even before your first period when you start a keto low-carb diet. Some doctors in the obesity world have women sign a form that says, I understand I might become pregnant as a result of my treatment. So I make it clear that if you don't want to become pregnant, you're going to have some sort of contraception if you're sexually active. But it's pretty exciting. I can recall getting emails, Dr. Westman, I just became pregnant. Thank you so much. And it's sad that you might have to go through that whole medical stuff and it doesn't work, and then changing the food works. But that's what we see because food is so powerful, it can be detrimental as well. And remember, it's the carbohydrates that lead to the insulin, that lead to the insulin resistance, that leads to the PCOS. And so we just bring you back down that pathway, but it can happen pretty fast.
Well, hopefully this episode will bring some great news to a lot of people that are watching, and we hope that they are willing and able to implement this program to give it a shot. And we certainly believe that it'll help. Eric, thank you so much. Again, to everybody, if you would like to see more of these episodes, you can follow us on our Instagram, Facebook, YouTube, and Twitter accounts under the name of Adapt Your Life. If you're following us on YouTube, don't forget to hit the notification bell to make sure that you are alerted every time we post one of these new videos, which is typically on a Wednesday. And if you enjoyed this video, please would you give it a like and a share. It would mean the absolute world to us. On behalf of Dr. Westman and myself, this is us signing off for another episode of Conversations with Dr. Westman. Until next week, thank you so much. Thanks, Eric.
Thanks, Glenn. If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.